So I guess I can start. Good morning, good afternoon, and good evening, everybody. I'm Cheol Heui Yun at Seoul National University. Before I start, I would like to thank the organizing committee at CJ Bio to give me an opportunity to talk about some of the things that we have done for past many years. Today, I would like to talk about gastrointestinal immunosecurity, how to maximize the health status of domestic animals. And I'll have brief introduction and go through also brief major issues in domestic animals and discuss with you about what and how we could study the immune responses followed by conclusion. So what's the stress is a response to a stressor as a root of stress. It could be an agent or a condition or an environment. It can be negative or positive and that have an impact on mental and physical well-being. If you look at the stressors in domestic animals, it could be nutritional factors or environmental factors, biological factors, and also physical factors. Some of which I marked bold in here that we have done in the lab. Then a few of those I will introduce today: unbalanced nutrient starvation, diet changes and temperature, microbiota, weaning, infection, and vaccination. So when there is a stressor, what happens in the intestine is that will have an impact on microbiota and causes dysbiosis. And not only that, but also that has an impact on immune cells and epithelial cells and the proteins that they produce. Of course, at the end of the day, we'll have a reduced productivity. So for better productivity, stressor-mediated microbial change and immune system should be carefully examined in domestic animals. So if you look at the major issues in domestic animals, I would like to discuss three different issues. First of all, gut microbiota and growth performance, antibiotic and its replacement, and anti-inflammatory reagent, but although this will be very brief. So we have to ask ourselves, what do we know about the gut microbiota and growth performance? I think it's fair to say that in human and mouse is very well studied, and therefore we know the composition of gut microbiota, and together with a correlation between microbiota and host immunity. And it's been studied on mucosal immunity-mediated modulation of gut microbiome by oral delivery of probiotics, and looking at specific part of immune system in the intestine. And also they've looked at how colonization by microbiota in early life that shapes the immune system. Of course, all these studies were using the mouse because they've used germ-free mouse in here. So we can get a hint about this, but there's some problem that I'll discuss with you later. So, and also we've looked at number of roles of probiotics, which is known to boost intestinal immune responses in terms of the safety, functionality, and technological usability. And also it is reasonably well studied on role of probiotics in alleviating post-weaning diarrhea in piglets, and looked at number of different parameters, including immune proteins and immune cells, and together with those microbiota. So in terms of the pre, syn, and postbiotics, and it is about microbiota and host. And also it's about interaction between microbiota and host immune system, together with diet and their metabolite. More importantly, I think each of those has different role in each case. And therefore, we have to consider diet effect, growth promoter, and also host protection, together with microenvironmental milieu. Well, if you look at domestic animals, then I think it's reasonably studied for past few years about composition of gut microbiota. But what we don't know much is beneficial and harmful bacteria, moreover, their interaction with immune system, and at the end of the day, how they affect the productivity. So I guess we are in need of understanding on correlation between microbiota, both harmful and beneficial, and then their metabolite and host metabolite, and then host immune system and its underlying mechanism. If you look at the antibiotic and its replacement, and it's been about over 10 years since we have banned antibiotic use in animal feed in Korea. It was July year 2011 as the first country in Asia, and only 5 years after the EU announced the banning. And then followed by some other Asian countries, and a couple of years ago was China. And still, we do have a question, and there's an article about this antibiotic as a feed additives, and there are a few more. And what it describes is a concern about antibiotic use as a feed additive. And therefore, obviously, people were actively looking for antibiotic replacement. So the replacement, there could be alternatives to antibiotics for growth promotion, including in-feed enzymes and propriocin and postbiotics, antimicrobial peptide and organic acid, and etc. But also those alternatives to antibiotics for disease prevention. And that would be vaccines, because prevention is always better than treatment. And also oftentimes we don't do a treatment to the domestic animals like human. Immune modulators and some others has been suggested. And of course, this has to be all based on proper sanitation through the farm management and biosecurity program. So what's the issues in here? Antibiotic residues and antibiotic resistance, and also lacking of a next generation antibiotics. The question is, do we know why we have had 8 to 10% growth promotion when we use those antibiotics in the feed? Or maybe not. Partially, I think we know, but still, I think that we need to know the mode of action mechanism. And is it truly only about the microbiota? I don't think it's the case, because the dose that we have used in the diet was it's not enough to kill the microbiota. Rather, they do have an impact on microbiota population, that's true. But also at the same time, they could have an impact on host immune responses, especially to the epithelial cells and immune cells underneath. And it's obvious that we are in need of the study on relationship among antibiotic, nutrition, microbiota, and immune responses. I'll briefly go through anti-inflammatory reagent, because this is not the topic today, but we have to understand that human and domestic animals are not the same, because in human, we care a lot about cancer and autoimmune diseases that are not exist in domestic animals. And next, then we have to think when domestic animals get benefit from anti-inflammatory response, and think about inflammatory related cells and molecules HER2 growth performance. The most importantly, we have to remember that inflammatory responses are not always bad. We need to have this response for fighting against disease and also after the vaccination. So if you provide anti-inflammatory reagent at the same time as vaccination, your vaccination is useless. Again, this immune system in human and animals are not the same. And also furthermore, so as among different animal species. And why do we have to study domestic animal immunology? Well, it's because we need to know mechanism and function. Why? Because to improve our understanding on health status, moreover, discover the way to protect host and to prevent disease. At the end of the day, what we want to have would be enhanced and high-valued productivity of domestic animals. Then the question is, then how and what to do in order to improve and enhance the immune responses? I would like to show some of the examples that we have done in the lab for past few years. We do immunology in domestic animals, especially against infection or for vaccination. And then we looked at a number of things, including competitive immunology, microbiome, stress, nutritional immunology, and then to mucosal immunity. And especially what we do is that look at the function and mechanism. We are not the company and we not produce product and we're not looking for profit. But what we do, looking at the function and mechanism, surely will provide some clue that can be used in the company. I would like to have two sections, and each section has a few studies. First of all, gut barrier function and regulation. We know that the intestine has a function for primarily digestion and absorption of nutrient, but also we know that there's a crosstalk between microbiota and epithelial cells, and also underneath they have these immune cells, and therefore there's a crosstalk between epithelium and immune cells. It's less well known, but we know that they do have a function for protection against the pathogen that I'll introduce briefly with one study that we have done at the end of this section. First of all, intestinal epithelial cells as a various function. Min-Jung, currently at the CJ Bio, looked at enhancement of gut integrity using TLR ligand in porcine epithelial cells. So we know that when we treat the DON to epithelial cells, then they have reduced tight junction proteins. But by providing toll-like the ligand or microbe-derived materials, especially from gram-positive bacteria, then actually that through the specific signaling by this receptor, and that protects this disruption by mycotoxin. That has been published. And then we looked at in vitro model to evaluate intestinal immune status. I think which will link to the Eileen's talk as well. So in this study, Eileen and Min-Jung, currently at the CJ Bio, had looked at those. The concept was when we treat mycotoxin, we know that there's a gut permeability and chemokine production. And so is changes of those immune cells and that immune proteins that are produced by those immune cells. And therefore, we might be able to examine the migration, pro-inflammatory cytokines, and then maturation and differentiation of immune cells in animals. But we thought about what should we do in order to do this in vitro, because in vivo will be quite tedious and time consuming and also a lot of money to study. And thus we looked at the system for co-culture. And basically it has differentiated porcine epithelial cells, and then you have immune cells underneath and looked at those parameters. And we have tried those concepts by using this mycotoxin, fumonisin, and hydrolyzed fumonisin, and looked at all those parameters. And we found that there's changes on inflammatory chemokines and cytokines, so as immune cells, and even there is an immune cell death. And this has been also published. And then we looked at autophagy. That's the trade-off in PDV infection. So autophagy is to maintain cellular homeostasis under stressful condition, especially starvation. And target molecules would be cytoplasmic content, especially damaged organelles, and also in certain cases, the pathogen. So how it works is that you have this M2 signaling and start with the ATG, and then elongation phase that induces maturation. At this stage, we called autophagosome. It fuses with a lysosome, and then we called autophagolysosome. And at this stage, because of the lysosome, there will be degradation. So in case if there is a pathogen involved in this action, that there's a high chance for the pathogen to be degraded. So make a long story short, what we have demonstrated in this study was by using rapamycin, we could be able to induce the autophagy. And upon the virus infection, when we induce this autophagy, that was able to protect from the viral infection. That has been published as well. So in here, I think that gut physiology and mucosal immunity orchestrate to play an important role against pathogen invasion and disease resistance in domestic animals. But still, we are in need for development of various sophisticated and biomimetic technologies in domestic animals that comparable to mouse and human. And next, we have looked at host and microbiota interaction. That we know, as I have already mentioned, that gut microbiota and microbial-derived molecules could promote regulatory function of gut immunity. That has been suggested, including some mechanism, but is in mouse systems, most likely. So what we have done is that we looked at regulation of intestinal immune system by gut microbiota first. And INGU had looked at microbiota, which regulate intestinal T cell population. So by using a mixture of antibiotics, we were able to remove most, if not all, microbiota from the intestine. And then further, that treatment showed the specific cell population changes, actually reduced those populations of the T cells, has been for over 3 weeks. And furthermore, there is a reduced immune proteins as well, called gamma interferon and IL-10. And then next, we co-house of those antibiotic-treated chickens with control that has a microbiota. We saw regain of those microbiota, so as those cells that reduced at the beginning. And next, we checked whether gram-positive or negative bacteria are responsible for these changes. And after the series of experiments, we found that there was a gram-positive which has the responsible for all these changes. And also, we know that there's an involvement of short-chain fatty acid. Therefore, we have treated acetate, propionate, butylate separately. And we found that not propionate or butylate, but acetate had an impact on those changes. And therefore, when we provide acetate, and those changes were back to normal. And also, we looked at various receptors, and we found that the receptors for acetate was very high in the cells that we have looked at as changes at the beginning. And therefore, collectively, gram-positive bacteria especially Clostridia, regulate both population and function of those T cells in cecal tonsils, and acetate seems to play an important role for gut immune homeostasis. In this particular study was published. And then we looked at antibiotics in gut immune homeostasis. In Huan, for his master studies, looked at antibiotics impaired chicken gut immune homeostasis. It's a bit cautious because not only because we have not published this one, but we have used fluoropenicol for these studies. I believe probably the only antibiotic which is allowed to use these days. And we looked at ileum and cecal, and by using the fluoropenicol at the level that is used in the field could induce dysbiosis. By looking at different parameters, including tight junction proteins, and also immune cells, and then immune proteins that are produced by immune cells. And there are slight differences of those immune proteins between ileum and cecal, but overall, we believe that this is because of the dysbiosis. Of course, we have to perform more studies. We have to look at withdrawal effect of this fluoropenicol. And also, we would like to look at further studies on opportunistic pathogen under this condition. So stay tuned for next result for a year to go. So I think in this part, we looked at the regulation of nutrient microbiota metabolite is essential for homeostasis of host immune responses. And still we are in need of further studies on relationship among nutrition, microbiota, metabolite, and immune responses in domestic animals. So the overall conclusion, and I have introduced the concept that with the diet together with number of parameters and strategy, including nutrition, microbiota, metabolite, immune responses, will determine the productivity at the end of the day. And therefore, we need to study on this. And if we think about how to strengthen the impact of productivity in domestic animals, I think the balance is the key when we look at nutrition, microbiota, metabolite, and immune responses. So we start with the nutrition, but we know that that has an impact on microbiota, growth and health, and also immune responses. When it comes to immune responses, it's sort of Goldilocks rule. It shouldn't be too robust, but it shouldn't be too weak. So it has to be balanced. But when we think about this balance, that inflammation and immune tolerance has to be well adjusted. So how should we do? We should work together. I think the collaboration is the key. In the field, they should follow the regulation, sanitation, vaccination, or unfortunately, we have animal welfare issue as well. And government should set a good policy and regulation and long-term plan and monitoring and support of those university and research institute, but also the field and farm. And as a research unit, we should do a study and research focusing on mechanism and function, as I have emphasized a number of times. We do science. But by doing that, perhaps this will help the company to produce the product, good valued high product for the field, nationally and internationally, together. Well, I guess that I have to mention a number of people in the lab that help. And also already left the lab, but they are working in various fields, and also professors in different universities, nationally and internationally. And thank you very much for your attention, and I'll take a question if you have any.